absolute nightmare. How did you find the dog?
It's from the people report.
They reported.
Yes.
Oh, thank God I could come so fast. Oh, God, oh, God, oh, God.
It's horrible.
And what did they say?
It's a few days here.
Oh, God, oh, God. So someone dumped it here.
Yeah. Someone dumped it.
It's a market here, right?
It's fine.
Oh, shit.
His one is cane and gold. And then he's so friendly.
Oh, God, shit.
I will.
You want to take it with your hands?
Please.
Okay, wait. She's not done yet with the cage. Oh, God, these eyes. Oh, absolutely. Oh, God, oh, God.
He's so friendly.
Oh, it's still a baby.
Yes.
It's a total baby. And everywhere was and bruises. It's unbelievable that it's still alive. Poor thing.
Oh my God. Yes. He's alive.
Okay. Oh, God, shit.
He's so sweet, Sabine. He's so sweet.
Okay, the cage is ready. Very careful. Very careful.
Sorry, yeah. He's hurting a little bit.
Oh, God.
Sini, dikit.
Oh, God. Vorsicht. Yes. Oh, good. Did you give him some water already?
Yes.
Okay, good.
Yes, water and food already.
Okay.
Okay, slowly,
Man.
be careful. Slowly, because it's not.
Yeah, we look after you now, Schwarzele. You are safe. You are safe now.
Yes, I think still young because
Of
the
course.
sticker is
Of
not so.
course. God. Okay, let's tango.
Ya keluar ya bentar, awak. Nanti itu. Ayo.
Yes.
Oh, kau takut sapi ini.
Good.
Pulas. Ya. Apa kamu nak? Beratmu nak? Ya ampun.
Very swollen. Do you think it's broken? Oh, God.
Awah. Okay.
I'm sorry.
Iya.
I'm Schwarzele.
Tapi dipakai.
Dipakai
Iya, dipakai cuman mungkin karena because of pasang sih.
Kayak masih keretak-keretak.
With the antibiotic, we will see in maybe around 5 until 7 days until the inflammation is going down, the infection is getting better. We will reassess again about the problem in this area.
Okay.
So when I did like a manipulation in here, there is like a sound, like a crackle sound on this area. But because it's still very inflamed in here, so it will be difficult to measure. So if the inflammation is already going down, the infection is getting better, so maybe we will reassess again and perform an
And
X-ray
it,
to this one.
okay, so no X-ray right now.
Maybe at the moment we will wait until the inflammation and the infection is going down.
Okay.
Because
Okay.
even there's something problem on this area,
Yeah.
we cannot do anything at this moment because it's still
that's
very
right.
inflamed and
Yes.
also very infected.
I understand.
Yes, that's
Okay.
right.
Yeah. Yes. He's the same, skinny like Lisa, but on top of it he has all these wounds.
Yeah.
Ah,
The wound is horrible, this one.
The around the legs. Oh, you have everything, huh?
Everything
You will be fine.
is only skin and bone.
Okay. But we are here now for you. Yeah. Don't worry. You're at the best place now. And then later you come to the safe house when you're healthier. Yeah. Yeah.
Thin.
Very inflamed.
It's thin.
Very inflamed and some wound also on
So the IV would hurt you a lot now?
yeah, but if he's good appetite, so maybe we will give some fluid from the, under
Oh
the skin.
yes, under the
Yeah.
skin. Okay.
Yeah, so
But he is dehydrated.
yeah, so
Of course
we
he
will give,
is.
we will give like a good food and
Yeah.
also water, and we will see how it goes. So yeah.
Huh? Oh yeah, that's a nice bed. Oh, such a it's a good bed for you, it's a kind, and I give him also some treats.
Yeah. Sini dulu ya sayang ya. Yeah. Stay here first. Look at her. Look at him. He's chasing her.
And itchy the ears also
Yeah.
inside for sure. He has an ear infection. Okay. Oh, he's eating. Oh, that's good. That's recovery food.
Yeah.
We will bring also later, huh?
Oh, okay. Yeah.
Huh?
you can-
But recovery food is anyway right now, I think the best. Yeah.
Yeah, because he's very skinny.
Yes.
And I think he still needs a lot of nutrition from the
Okay. Okay. So maybe for a few days we first give, or you know, we have beef liver, chicken.
Yeah, we can give anything for him actually. So
Okay.
if he's good appetite, so normally yeah we need some.
Or we can mix maybe some
We can
recovery
mix,
food with
yes.
our fresh cooked
Yes.
one, huh? We do that. Okay, that's good.
Biasanya terus
look
kondisinya
at your
sebenarnya masih
eyes.
stabil nih, mau makan sebenarnya, cuman ya karena malnutrisi terus kayak gitu. Tapi kalau misalnya mau rule out ya nggak apa-apa, nanti kita lakukan sekalian.
Yeah.
Cak giginya tuh bikin gagal.
But this condition is already going
Better.
better.
Okay. Oh, I think you will have a good sleep now.
Yeah, after eating.
Yeah. First time feeling not hungry for who knows how long. You sleep and we will come back soon, sweetie pie. Yeah. Getting better. Time to heal. Hello. Hello, Settle. Hello, Mobersley. Ja, hallo. Hallo. Wie geht's dir denn? Oh, Schatziputzele. Oh. Oh ja. Schatzelein. Hallo. Hallo, Schatzelein. Wie geht's dir denn? Are you tired, Schatzelein? Oh yeah, this is, of course. That's yummy, huh? Oh, good. Oh, Schatzelein. That's good food. With chicken. Yeah. Oh. That's what he likes. Have a little bit more, but not too much. Yeah, now he comes out. Yeah, let him out a bit. Ah, what a good look. Yeah. Okay. Good shot. Okay, you can put the new bed in. Yeah. Let's get a new thick new bed in. Yeah, perfect. Yeah. Good. bed. Oh, schön. Oh, he likes his bed. Oh, Rico. Oh. Oh, that was good food. And now you have another rest. Yeah? Oh, Herzelein. Yeah. His ears are itchy.
Yeah.
Oh, Herzelein. Oh, God. Oh. Oh, it's so swollen. You see that?
Yes.
Oh.
Yeah.
Yes. Oh, that's a good spot. Oh, that's a good spot now. Huh? Yeah. Just want to sleep. Oh, yeah, thank you. Oh. Oh, boo. Huh? He's just tired. Gentle. Yeah. Yes.
Okay.
Yes.
Yeah.
Is that good? Feeling warm? Feeling good like this, Boo-boo? Huh? So you sleep, and we come back tomorrow. We have a good rest and eat a lot, and drink a lot of water. Boo-boo? Yeah. Just sleep.
Morning, sweetheart. Hello. Hello, sayang. Ini. Uy. Oh, no. Awe, masih ngantuk. Masih ngantuk dia. Ya, ini bagus nih. Hah? Hah? How are you, sweetheart? How are you? Oh, sekarang mah enggak ya. Sama aku enggak. Dia kutil-kutil. Oh, cucu. Dia wiggling the tail. Look at him. Oh, baby boy. Yuk makan yuk. Makan yuk, mam yuk. Iya. Cucu. Ayo. Boy. Ayo malam. Hai Kibo. Gimana kabarnya nih? Mam dulu ya? Mau makan dulu. Ayo Kibo, sini Kibo. Lapar, pelan-pelan.
Udah mau habis. Iya.
Kayak ngobrol dia ya.
Aduh, enak. Ini mulai kering ini Kibo. Iya, udah bagus ini ya. Juga ini udah kering. Sudah bagus ini. Iya. Kaki enggak. Cepat sembuh Kibo. Lagi sebentar aja ini ya. Iya. Iya. Kita pakai ini.
Ih, pasangin dulu ya. Pasang dulu. Biar tambah hangat. Itu. Ya. Tambah hangat nanti kibonya. Bobonya nyenyak ya. Tidurnya. Jadi nggak kedinginan. Oke. Udah. Boleh deh ya.
Kibo.
Kibo. Ya, sini ucap. Ya. Ucap. Yuk, masuk sini. Ini Kibo. Naik sih. Bantu.
Aduh, good job.
Ojo Kibo.
Iya. Udah enak, ini udah tebel sekarang. Iya. Minumnya sedikit
Minum
ya.
dulu.
Udah.
Oke, Kibo.
Udah.
Ya. Ya. Muter
Oh iya, duduk tuh.
Ini. Oke. Istirahat ini ya, ada mamam ya. Iya, Kibo ya. Aduh, temen bubuk nih sama Dek. Sama Dek. Iya. Enak. Ini dikit-dikit dulu. Nak Kibo ya? Iya nih. Wih. Ini lagi jatuh. Wih. Iya. Enak ya. Nyam. Enak. Ini lagi.
Wih. Aduh. Enak ya?
Ini? Iya. Ya, nyam. Enak. Enak. Uyu. Nah.
Udah kenyang ya?
Ganti udah mamam.
Kibo nih. Ganteng sekali Kibo nih. Ganteng sekali ya. Aduh gantengnya. Iya. So cute. Aduh sedikit ya. Aduh. Mau bangun makan? Aduh. Slowly. Iya. Enak nih ya. Enak. Ini. Enak kali.
Yummy.
Sampai kayak gitu makannya. Ganteng. Aduh. Kayak gini ganteng nih. Aduh, udah makin sehat, makin gendut. Langsung ya tahu, langsung berdiri. Udah? Iya, ganti dulu ya kasurnya ya. Diganti dulu kasurnya. Sambil nungguin Kibo habis makan. Diganti kasurnya. Ya, tungguin ya. Tungguin dulu kasurnya diganti.
biar makin anget tidurnya Kibo, makin nyenyak. Oke. Iya. Baru tuh lebih tebal kasurnya. Enak.
Okay, so this is from the X-ray result. This is the left leg, yeah, the one that's still like swollen until this time. The main problem is actually like this part that got dislocated. The normal view is like this, but this part and this part get like dislocated and then like slip like this, yeah. And this is the other. Oh, this is the measurement, and this is, yeah, we can see there are like 2 bones over there, and then I think it's both dislocated and this part. Yeah, we're still discussing with our surgeon, but I think at this time like he's still quite fragile and also like needs some recover from his current condition first, and then we can discuss about the surgery later. Yeah.
Ngantuk. Udah makan, ngantuk. Aduh. Tidur di bonekanya. Aduh. Enak ya? Udah kenyang. Kibo. Tidur ya?
So bad. I want to kiss you. I want to take you home so bad. You know? It's so bad. Huh? Kiba. Kiba. Kiba.
Kibo, I love you so much. Hiya. Love you. I love you. To the moon and back. I love you so much. Oh my God, your face is so beautiful. You know your name already. Kibo. 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 You know his name already. Yay. Tengtong, aduh, kakinya tengtong gitu ya? Hah? Kakimu tengtong gitu? Aduh. Kibo, Kibo le, I love Kibo, Kibo, sayang Kibo nih, sayang Kibo nih. Iya. Apa tuh yang
You full? Don't want to treat it. His belly looks really thick. You ate a lot? Yeah. You ate a lot?
And put here, and then later you can.
No. He just wants to sleep. That's what he wants. Eat, sleep. Eat, sleep. But that's exactly what he needs. Right? So we don't disturb you any longer. Let you sleepy peep. That's the line. You don't know that yet. But later you will come to our safe house. And that's even much nicer than here. And you won't be in a cage anymore. You just have a nice bed and you can walk around. When your paw doesn't hurt anymore. Right? Yeah. Come to us. Meet all our doggies. Yeah, they will all be very nice with you. But now you sleep first. Yeah.
boleh. Ayo. Ayo sayang. Ayo. Ayo nih. Ayo teman.
Bednya mana bednya? Hah? Wih, makan nih.
Selalu antusias kalau makan.
Iya.
Kenapa? Tuh kayaknya sedih. Enggak. Ya, jangan marah-marah.
Marah-marah dia.
Apa? Treat. Ya, duduk.
Kayaknya duduknya gimana menangkanya?
Treatnya apa?
Treat.
Kayak biasanya. Bisa? Oh, aduh. Ya, kita gitu. Pakai bandage ya. Aduh, desel. Ya,
Nih. Coba. Coba. Gigitin, Mbak.
Kimo.
Kenapa, Nak? Hah? Kenapa kamu kayak gitu?
Kenapa? Marah-marah? Mana yang sakit mana?
Susah jongkok, susah
berdiri juga susah.
berdiri, susah dia.
Tapi kayak baru sekarang gitu kemarin-kemarin
Iya.
jalan. Tuh, jalan juga tuh. Gitu,
Coba.
Ini kita. Aduh, makan. Iya. Morning. Aduh. Hey. Aduh. Iya. Hai ibu. Apa ini? Oh, mau dibawa makannya sekarang. Udah makan tadi ya Kimo ya? Ada popok di luar. Udah pipis. Kenapa? Ganti dulu ya. Bednya diganti dulu. Aduh. Pelan-pelan ya. Nah, aduh. Yo. Enak ya.
We see from the other view, from that he has this condition. So like there is a broken part here. So like it's also like causing compression between this one and this one. So at some point when the spinal one here is also like got damage, usually also like affecting the back like that. But so far like he is able like to control the urination, able to control the poo. So we really hope that the other condition is also can be fixed. Right?
Dulu Kimo. Aduh, udah gak sabar. Ada langsung naik. Iya. Aduh. Apa situ?
gitu.
Iya.
Kibo. Halo Kibo. Mami Kibo. Aduh sayangku. Ayo, mam dulu. Mam ini. Mam.
Iya.
Iya. Paling happy nih kalau makan
Iya,
ini
langsung.
Kibonya.
Banget.
Kan banyak biar cepet tumbuh ya.
Pelan-pelan. Waduh. Banyak gitu.
Diganti dulu ini. Pakai ini ya.
Nanti lagi ya, tunggu. Diganti dulu ya.
Aduh.
Diganti dulu. Iya. Tunggu langsung. Coy. Sudah selesai. Nah, tuh udah selesai. Apa lagi? Udah diganti lagi bednya. Iya.
Cantik Ibu ini. Suka mainnya suka? Suka? Lagi?
Enak.
Suka main sayang ini? Mana? Banyak ya? Wih, enak deh. Titip-titip lagi ya. Enak ya. Nah habis. Nggak habis? Nggak habis karena nggak enak ya. Kadang bubuk ya, bubuk tuh kadang ya. Istirahat dulu ya. Banyak mam ya. Bubuk Kibo. Udah kenyang kadang bubuk ya. Iya. Kibo kadang bubuk ya. Ini udah kering semua ini Kibo. Kibo ini kering juga ini Kibo. Wih, sebentar lagi dari ini ada cembuh ini ya. Semangat ini ya, semangat ya.
Tidur ya. Ya. Istirahat ya. Sembuh ya. Where is the baby boy? Halo. Halo herzlein. Halo Kibo. Hello. Hello. Oh, he's making his tail. Oh, little boo. He looks like he has more energy again. Doesn't he? Hello. Hello, Bubule. Ah. One spot where I know here it Yeah, I know it's wow. I know you are so in our and it's not fair. It's not fair. No, I know. We are trying our very, very, very best to help you. What's your line? Are you in pain? Oh, Herzle. Oh, poor Herzle. Oh, poor Herzle. Oh. Oh, poor baby. Oh, what we do? Oh, shots. Alright, Jatiline. So, we'll take you to the safe house now. Yes, please. Thank you. Yeah, you come with me. We go to the safe house and see that you can be a bit in the sun. You see how you're doing there? Yeah? That's a line. So, oh, good. Don't be worried, Shatiline. Ano pinaya? Yun? You get him. Super. Very careful. Very, very careful. The little bubule. Yes. It's okay, it's okay, yeah, it's okay, it's okay. Good boy, yeah. So, little boy, now you are coming with me. And we go to the safe house, what I promised you. Yeah, and here is your bed that I got for you. Yeah, should we go? Let's tango, yes. Let them just mate him for a second.
Oh my god.
Kibo, look.
So many ducks. Look at them. Yeah.
No. Be nice.
Be nice.
Everyone be nice. You see, Kibo, I told you we have many doggies. Here he comes. Oh, Shatiline, yeah. That's your garden. Oh, God. Look. Oh, the Kiwi has a garden. First time outside again.
Oh, Fifi.
So we can put him another bed here first that he's outside. No, he doesn't want to go in the bed. He wants to still check out the place here. Okay. Lying in green leaves, grass. Yeah. Yeah, much better, huh? Than in the clinic. Yeah, you can take a rest here now. You can take a rest, little boo-boo. Are you happy? You just want to look a bit around now? Yeah? That's a line? But then you have to take a rest. You have two beds, one inside and one outside. You can choose. Here. Bye-bye. You take the small one outside? Okay. All right. Take a rest. Yeah. Taking a nap? Yeah. That's what you need. Outside, fresh air, natural light. Yeah. So many new people, huh? People? Yeah, we are so many looking after you. There's so many. Yeah, we all care for you, Kibo. Yeah. All are caring for you, little boy. Hello. Nadu, little man. You're not lying in your bed? No? No, no? Not in your bed. But wagging your tail. You're wagging the tail, yeah? I was with the other doggies for a while and I want to look for you again, how you're doing. I know your poor Chihuahua, but we have to wait a bit and then we can fix it. Not now. You first have to put on some weight and you have to get more healthy and stronger. And then we can help your paw. Yeah. Huh? Hello. Oh. That's nice here, yeah? Yeah? Oh, you're such a good boy. Oh, you're such a good boy. Yeah. Do you like it? Much better now than in the clinic. Little boo-boo boy. He's fighting. He's so fighting, this little boy. Eating well, drinking lots of water.
Nice one. Oh, this one.
Yeah. So yeah. You are a fighter. Good boy. Yeah, he needs to drink especially a lot with the medication he takes. Ah. Show me your leg again. Show me your leg. Show me your leg. Oh. Look at this. What a difference. So much better. It was completely to the outside before.
Yeah.
Huh?
Yeah.
Look at this. Shatsi line.
And before was like this.
Yes.
Like this now is like this.
Look at this.
Good job. Apanya sakit? Masih sakit? Masih sakit? Masih sakit. Apa?
Oh, God. Oh, yeah.
Mana sakit mana? Mana sakit?
Oh, God.
Iya, mana
Oh,
sakit?
God.
Matanya sakit. Iya. Sakit sekali udah mampir tadi. Udah mampir. Ini ya, Kibo kan udah mampir tadi. Iya, mau gendong. Kan Kibo mau gendong. Iya.
Yeah, careful, still.
Iya.
So that he doesn't make any silly moves. Yeah, he's all over you.
Iya. Slowly, slowly. Slowly.
Oh, he's ready for belly rub. Look at him. Now, he's ready for cuddles. Aren't you? Shajiline.
The boy is better.
It's so much better. I can't believe it. But it really happened now. Yesterday it was a bit better, and today it's
So much better.
so much better.
Super. He's super boy. He's the super boy.
Have to clean himself after the food and drinking lots of water. Yeah.
And the tummy is already big also.
Yeah, much better.
It's not only rib and skin
No,
before.
look at
Only
him.
skin and bone before. Only skin and bone.
Oh, look at his tail.
Yeah, only skin and bone. So good. Yeah.
He talks so much.
I love you. I love you so much, people. Yeah, I love you.
And now it hurts him again. Something hurt. You see that? And he shows you that it hurts him. It's still our Schatzele, but much better. We are getting there. Still our. But not all the time, only if you move a bit. Weird, Schatz. carrots. Yeah.
So much love.
So much love, so much food. Yeah. Oh, Elaine, you look much better today.
Iya sayang.
Oh,
Iya sayang. Iya. Iya, I love you so much. I love you so much. Iya.
he knows.
I love you. Iya. Iya, I love you. I love you. Iya.
Oh, look at him. Oh, look at him.
Iya, stretching ya. Iya, stretching ya.
Oh, Esther. Oh, yeah. Oh, God.
Oh yeah, I know. Gantengnya, ganteng nih, ganteng nih, si ganteng nih, ganteng mama nih. Are you happy? Are you happy today? Iya, tidak sakit. Iya. Mau kemana dia? Sini lebih enak. Ayo, ayo. Iya. Iya. Boleh. Mana ini? Hati. Di mana?
Kemudian mencetok-cetok tuh. Karena berpelah daunnya tetapi
Pelan-pelan.
Iya. Capek sih. Capek ya. Aduh, capek dia. Udah mulai lungi. Iya. Ekornya, aduh. Bapak situ ya? Apa? Keyboardnya. Aduh. Istirahat.
Iya. Ayo, ayo. Boy, 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 my boy, boy, my boy. My boy, my boy. You are
Mana suaranya,
my
mana?
sunshine lagi. You are my sunshine. You are my boy. I know. I miss you too. I miss you. Aku hancur.
Kemarin gak ketemu sehari.
Baru gak ketemu sehari. Aduh, gimana kalau nggak berbulan-bulan ketemunya? Ayang aku nih. Wah. Itu suaranya. Mana suaranya?
Di dalam dia baru mau.
Dia mau ngomong, mana suaranya? Mana suaranya? Bagaimana mana suaranya bisa nggak? Masih pakai suara. Aduh. Mana suaranya?
Suaranya mana?
Mana suaranya? Mana suaranya Ibu?
Mana suaranya? Suaranya mana? Suaranya?
Tarik nafas dalam-dalam.
Lagi ngapain barusan? Iya. Aduh, sendiri. Udah makan ya? Udah makan? Ya. Main yuk, main. Mana suaranya?
Lagi suaranya. Suaranya mana? Lagi suaranya boleh? Ayo keluar ya. Boleh.
Wah, ayo lagi jalan dulu. Stretching ya? Waduh, cepet banget. Udah makan. Sekarang tidur ya. Nanti main lagi. Gigit-gigit boneka. Udah capek ngantuk. Gigit-gigit. Iya, boleh main-main. Aduh, iya, apa sih manggil itu kayak gitu manggil? Apa?
Ini kan tidak emergency operasinya. Biasanya kita pokoknya kita vaksin, kita siapkan dari dulu supaya 100% bagus, dan juga penyembuhan di sini perombakan supaya stabil perombakan. Kenapa? Karena nanti kan ini akan bebannya berkurang. Habis operasi ini akan dia bebannya berkurang mungkin selama 2-3 bulan bebannya yang berkurang, atau hanya itu sih kadang-kadang sebulan akan menyesuaikan. termasuk juga tulang belakang. Jadi nanti sedikit situasi. Kalau kita nanti setelah operasi, ternyata dia, mudah-mudahan kalau ternyata habis operasi 2 minggu 3 minggu kemudian ternyata dia kena paku. Nah itu kan hal yang kita udah antisipasi, tapi udah kita antisipasi tapi kejadian juga. Beda kalau kita belum antisipasi. Kalau patah tulang misalnya kecelakaan yang tulang belakangnya itu udah kuat ya.
Where's your little boy? Yeah, he's very happy. He put again weight on. You can see every day a difference, Krista. Yeah, yeah. I think you are waiting for a treat again. I think you want another treat. You know that I always have treats. I'm the one with the treats in the back, right?
So cute.
Are you? Do you like treaty teas? Little boo boo?
Happy, kibonya happy. Sit dulu, sit. Sit kibonya. Sit. Happy nggak? Happy kibonya. Iya sih, pinter. Sit dulu ya. Iya. Aduh, waduh. Wih. Sit. Sit, duduk dulu, duduk dulu. Duduk dulu. Wih deh. Duduk dulu, pinter duduk. Sit, pinter. Ayo. Let's go, let's go, let's go. Waduh, pelan-pelan. Pelan-pelan. Pinter. Nggak sabar nunggunya ya. Udah lapar, udah jam makan lah. Jadi lapar. Eat slowly. Suaranya mana Kibo? Suaranya? Mana suaranya mana? Iya. Pelan-pelan duduk kita duduk. Iya. Sayang. Coba boleh istirahatnya pegang tangan aku. Pegang tangan ini. Nggak boleh lepas ya. Nggak boleh lepas ini. Pegangin sama Kibo. Nggak boleh pergi. Temenin Kibo di sini. Iya. Temenin ini ditemenin. Ya. Lucu Kibo ini. Istirahat ya. Apa itu? Suara apa itu?
He's so happy. He's so happy. He's wagging his tail. Hi, sayang. Halo, Kibo. How are you? Halo, sayang. That's mean. What is licking mean, Kibo? Are you singing? Lagi. Can you sing it again? That's so cute. That's so cute. Oh, that's so cute. Kibo. Thank you for singing. Okay. Kibo, are you singing for us? She's singing for me. Wow. Suaranya merdu sekali loh. Oh ya.
Pelan-pelan ya. Yuk. Ya, slowly.
Just walk. He's like, what am I on? How is that? Okay. Okay. Here he goes. He likes it. Look. Who is that doggy? He wants to come with us on a walkie walk. Oh, look at him. It's the first time on the leash. I think he's doing perfect. Huh? No, never. Amazing. You want to go down there? Not so sure. Super.
You are such a good boy. You are my super boy. I know. Oh my God.
It's really amazing how he does on the leash, huh?
Oh my God, for the first time. And then
Super.
good. Yeah. I'm so proud of you. I'm so proud of you.
Sekarang kita kasih paknya.
Nice.
Oh, so excited, this one. This little boy is so excited. Wow. Udah mam banyak dia nih. Mam treat lagi sekarang. Kibo. Dan? Oh, udah habis? Oh, udah habis. Oh, there's still some. Oh, shit. Sakit ya tangannya, mana coba lihat tangannya yang sakit mana. Aduh, sakit tuh. Habis dioperasi. Tapi besok udah sembuh ya. Mukanya kayak bu. Be careful. Good job.
Who is back at home? Hello, Shatilan. Hello, Kibo. Oh, you are. Yes. 1 second. We get you out. 1 second. They're coming.
Oh, look at him.
Get her out.
No. We have to get him in, but he was barking before.
Yeah, we get you out. 1 second. We will.
Back.
Coming back.
Come in. Oh, look at the boy. Oh, Shatilan, you're back.
Are you happy?
Coming back. For sure. Now you made it. Now everything will be really great from now on, right?
Yes.
Yes, you need
For
a little
sure.
bit of a rest, but
Yes.
but then you can run like no other. Welcome back to the safe house, little sweetie pie. We missed you here so much. Look at yeah. So, that's lying your bag. You know what, Krista? I think we first let him make a pee-pee out in the garden, and then we have to use the pen. Oh, drink first, yes, and let him bed first. Oh, you drink something first? That's a line. Put him down, and then we have to make the pen on, because you're not allowed to run around, sweetie pie. No, you made your pee-pee in the pool, and now it's resting time. Are you happy? Huh? Are you happy you are back? I know you're happy. We have you back. Oh, look at this happy boy. Oh.
Oh my boy, you are come back. I'm so happy. I'm so happy to see you back.
Yeah. Now you made it through the hardest, the surgery. That was a big one. Yeah, in your pro. Missed it. Another one. He starts again. He hasn't lost his singing skills. You can still sing when you see Krista, yeah?
Senang di luar. Senang di luar.
Lihat yang lain. Soalnya sendiri dia di dalam.
Iya. Ibu ya. Aduh. Gitu sayang. Aduh. Aduh.
Lihat pemandangan. Lihat pemandangannya bagus sekali.
Nggak mau.
Lihat tuh airnya. Nanti kamu bisa berenang di situ ya. Bisa berenang di situ. Itu tuh gunungnya tuh. So beautiful, the mountain. Oh my god. Hah? Look at it. Look. Kita nongkrong pelan-pelan tapi tipis.
Nah, langsung.
Langsung.
Biarin dah, video aja.
Sana aja lah.
Biar tahu.
Tuh.
Banyak banget. Udah jalan. Wih, Bo.
Oke, saya lucu. Lucu tadi. Mama,
Berjemur.
belum ganti orang yang lucu tuh. Ibu ganteng.
Senyum.
Handsome already.
Senyum.
Aduh, Bang.
Ganteng kok.
Ganteng kali lah. It's my boy lah. Look at that, the mountain. Ayo, my boy. Kalem kali kamu.
Iya, tumben.
Tumben kalem.
Nala.
Kok nalak?
Nyariin Nala.
Lihat apa aja? Coba. Hah?
Sekarang tak buka ya? Kan udah 15 hari kan?
Udah tanggal 1 dia operasi.
Paling lagi sekali kan ini.
Oh iya.
Apa-apa Kibo, penting aku sebentar.
Berontak.
Iya.
Dulu nggak pernah.
Belum pernah.
Harus tak pasangin gini kayak apa? Nah,
Selesai. Tuh pintar.
Iya.
Itu udah bagus nih.
Bagus sih sekarang kondisinya.
Cuman sih kalau dijilatin lagi.
Kalau dijilatin lagi gini. Okay. So from the X-ray we already did on Kibo, the plate still in a good place. So the screw also still intact. No problem with the plate or the screw. The thing is here where the inflammation goes, maybe because it's pressure between the bone joint. So this is where the bone joint later will become one. With this condition, maybe later in like 3 months or 4 months after the bone completely heal, we might need to remove the plate and the screw.
Kibuli, you are so cool, huh? Huh? Oh my god. Boy, Kibo. Jalan pagi Kibonya.
Kalau jalan cantiknya kan bisa.
Iya tuh.
Bagus ya. Jalannya. Ya Kibo ya. So nice the air, so fresh in the morning.
Bobo, is it still a little bit swollen? His paw? Yeah, still a bit. Yeah, that's why we have to do slowly, Kibo. Yeah. Soon.
Very soon.
Soon you will be free running. Huh? Bobo. Yeah. Slowly. Just a little bit playing. Naya wants to be friends with everyone, huh? Yeah, soon you can play like Naya. Oh. Little boo-boo. Oh, it's a little boy. Cute. He's too shy to be.
Bawa anjing lain
Iya.
nih, bawa kucing yang lain.
Langsung.
Aduh, panas sekali ini ya. Oh my good boy. You look at your wound. Oh, they're good here.
Ghibli. Oh, here you are. In your you're beautiful, babe, and you can't jump too much. Oh, that's the problem. He's just heavy. You can't jump too much, Kimberly.
Don't like that. Like that. Here and this hour. You know this hour? So I want this one.
Kissing and running.
I love you so much. Adi. Listen, you do that to me, right? I do that to you.
Little boy, I know it's annoying, but you cannot run and hop around for a little while longer. Cannot. You can't. No. Cannot. Slowly. Little healing, Kitty. And then you can run when all is healed. Not now. Not now. Yeah. He's such a gorgeous boy. Yeah.
You love me? Yes.
Yes, he does.
The same.
Oh, Kitty. Oh, boo, boo. Oh, shit. Oh, yeah. And later you can go for a quick walkie again. A quick one.
Yeah.
Not a long walkie, only little walkie.
For exercise. Okay. Yeah. Like that? Bocah berdua cantik banget. Udah. Enough. best friend is coming. Naya, Naya, you are next ya. Finish. Oh, so handsome right now. Ki boleh. Siapa yang menang? Kibo or Naya? Kibo. Waduh. Waduh. Pelan-pelan ya. Aduh ya. Aduh. Nah, now you busy with the toys. Oh. Hang out in the garden ya. What is that? Wanna play with Kibo? Kibo. Oh, careful. Aduh. Sharing toys ya. Aduh, the puppies play together.
Jadi lagu Bali.
Boy anteng gitu ya.
Ini good boy ini.
Boy ini main boy nih. Ini good boy, udah ganteng, good boy ya. Kalem nih, kalem katanya. Kalem dari mana? Kalemnya dari mana? Ya.
Oh. Baby. Oh. Kibo line. Oh, you get your nails cut.
I try to.
Yeah. Now he sits there. He's getting your nails cut. Kibli. Yeah. Oh yeah. Oh, good boy. Oh, you are so brave. Oh yeah.
So ein Süßer.
Ja.
Und der ist wirklich in den 3 Tagen echt, also schon so gut geworden jetzt.
Ja. Der Schatz ist echt geschnappt. Oh. Der liegt hier einfach wie so ein Baby auf dem Arm. Ein kleiner Bub. Ein kleiner Babybub.
Iya. Oh. Oh. Baby.
Anfassen. Und sein Füßle drauf, das Füßle steil. Ja. Ja, also wenn er rennt, normal ist alles gut. Manchmal zieht er so ein bisschen hoch. Coming back.
Oh, he keeps coming back. Oh,
They always know.
yes. Oh.
Hat er mit Vollständig. Wirklich. Ist das nicht
Kibu.
unglaublich?
Ui.
Ja, Kibo, ich komme.
Ja,
mein
Ibo.
Papa coming.
Yes.
Ja, die sind alle ganz groß.
Oh yeah. Oh. Look at him. Yeah. Oh, oh my god.
Ah, thank you so much, guys, for adopting our gorgeous Kibo. Oh my God, thank you, thank you. This is so wonderful. Kibo, you will have the best life ever. You're such a lucky mama. Are you happy for Kibo?
Yes, sir.
Are you so happy?
We miss him.
Yo. Here we go.
Bye-bye, Kibo. Bye-bye.
Oh. Yeah, he looks very happy.
Kibo. Bye-bye, Kibo.
Ich glaube, wir sind aufgeregter als du. Ich glaube, wir sind aufgeregter als du.
Super.